Today is October 15th. It's 2:30 in the afternoon. Tonight is the rally at Menifee between 7 p.m. and at least 10 p.m. I am actually making this video blog to address some comments that are going on over on the Press Enterprise that I'm going to link this back to. As far as I'm concerned, you know, I speak for myself in this blog, and I speak for many coworkers that I personally know who were not in any disciplinary actions, had perfect records. There was an 18-year employee who had never been written up who was let go. So I don't think that people who are commenting on the Press Enterprise have the full scope. So let me just say, like I said, when I started my blog, I'm going to be more specifically telling you my interactions with Menifee Hospital, with Valley Health Systems, with PHH. On October 7th, 2010, at 9 o'clock in the morning, I met with the administrator, Rick DiCapo, of Menifee Valley Medical Center. He is actually not only the administrator, he is the chief nursing officer, and I believe he holds one other title. Rick and I met to discuss how we could improve systems within the hospital. He had solicited my input on how to improve things in the hospital, and actually I will be posting the actual emails that I have had with Rick DiCapo to this blog at some point in time. I am the type of person who would be solicited for my ideas on how to improve processes in nursing systems based on my experience as a nurse, as a staff nurse, and my experience in management and in specifically the critical care arena. So 4 or 5 days before I was terminated, and let's get this straight for the other commenter, not rehired is a legal loophole that has to do with a successorship of a bargaining unit being carried over from one owner to another. They are putting themselves in the not rehired loophole, which it's illegal. I don't really have time to explain that or express that here, and I'm not the lawyer, but I do know that that it is not appropriate to fire people who are in a bargaining unit when the owner changes. But let me get back to this Rick DiCapo thing. I sat down with Rick DiCapo and brought suggestions and ideas from staff. That was my role there in that facility. We discussed implementing a clinical practice committee whereby staff members who are responsible for providing care would have input on the mechanisms and the systems in place to provide, you know, the appropriate care. So let me explain to you, let me give you a little, just a touch of an example and a snippet of this conversation. For instance, when a new employee is hired there, the system for orienting and making sure that that person is competent and making sure that person gets adjusted to their unit is somewhat non-existent. And even though they have made attempts in the past to make it more streamlined and more organized, it has not been successful. So what my role is in all of this is to come to a person like Rick DiCapo and say, this is what's happening. I don't know if you know that this is how it is. A person is being hired and being precepted by multiple preceptors. They're getting multiple different messages. We don't have handouts to give these employees. We don't have a way of assessing them within that 90 days so that we know that they are really clinically competent to take care of patients. This example was based on a recent nurse who was hired in the ICU nights, who is, by the way, still there, and I'm not, who actually is not a trained ICU nurse. And it was not known to the staff that she was not a trained ICU nurse until it came to a critical situation where her patient was deteriorating and she was not able to act. And so that was of a concern to me, because when the management hires staff and throws them in there, we expect for them to be functioning at an ICU nurse level. And that was my concern. And so my concern is, how did she get to this point of being off of orientation and not being clinically ready? So it's things like that. That was my role. You can say that you think that I would, what I wrote sounded like I would be a complainer. I am not a complainer. I am a mover and a shaker, and I am a thinker. And I am not only one who will come to you with an issue, I will come to you with a complete plan to correct that issue. That is the nature of how I work. And so, excuse me. And so my voice is still a little shaky from all the yelling last night. So I wanted to put this quick vlog out here for the commenter. Please be aware that you don't know the full story, and that's one of the reasons why I'm here and being vigilant on the Press Enterprise, and I'm being vigilant about my blog. And like I say, the people that they let go were more or less people like myself who were the ones who were keeping the safety net somewhat in place. We are the ones who are keeping management accountable to putting competent staff on the floor. And what you read in this paper about there being 96% retention rate and only 4% being let go, and that there's been no change in the staffing because of the staffing ratios. Well, what I said to you earlier is a perfect example. Yes, they have a nurse there, but she is not a critical care nurse. She is not clinically competent. And so if you would rather have a nurse like that taking care of you in a unit where she's not really trained to be, but yes, she's a nurse, and yes, the staffing ratio is intact, but she's not really competent to take care of you, as opposed to someone like myself who has been an ICU nurse for 21 years, has worked ER, has done critical care transports, has a strong, extreme. I was actually certified as a critical care nurse back when the level of education and knowledge was, the standard was higher. I held my CCRN. Okay, so anyhow, just wanted to address that to you, and you know, I appreciate your comments in response to my comment on Press Enterprise, and so this one's for you. Thank you.